to the World Health Organization, 1 in 13 globally suffers from anxiety. Additionally, according to ADAA.org, almost 75% of people with mental disorders remain untreated in developing countries, with almost 1 million people taking their lives each year. So with all these problems affecting our world today, with no known foolproof cure, what can we do? Well, let me introduce you to hypnosis, a method that should be utilized more often in the medical field. Despite all the cures being developed to treat addictions and mental disorders today, hypnosis is proven to be one of the most effective. And this is mostly because of how hypnosis works. For example, as Coed explains in her article on Medical News Today, suggestion has been used to induce agnosia, which is a state wherein the brain can perceive but is unable to recognize various external stimuli. Because hypnosis affects how the brain perceives things, it can also affect how the brain perceives pain, emotions, and other factors that lead to mental disorders. Thus, hypnosis should be utilized more in the medical field and should be utilized in treatments for addiction and mental illnesses. So one solution to the many afflictions that exist in the United States and the world today is to use hypnosis in rehabilitation treatments for addiction. For example, as Amy Solomon says in her article on everydayhealth.com, at the 2011 annual meeting of the American Psychiatric Association, Jose Maldonado, who is a doctorate and is an associate professor of psychiatry at Stanford University, reported that the success rate of hypnosis for smoking cessation may be as high as 64%. Just the fact that hypnosis can lead to a 64% success rate for smoking cessation shows just how effective hypnosis is in the medical field and just how much it should be incorporated and how it should be more prevalent. Another solution to the afflictions that exist in this world today is to use hypnosis for medical treatment for mental health issues, such as anxiety. For example, as the Harvard Mental Health Letter states, in a 2006 study, for example, patients who underwent hypnosis received suggestions of well-being before surgery. Upon entering the operating room, they reported anxiety levels 56% lower than anxiety levels before hypnosis. Patients in a comparison group who received the normal pre-surgical standard of care reported a 47% increase in anxiety. Looking at how the standard of care we use today actually leads to an increase in anxiety, while hypnosis leads to a decrease in anxiety, it shows just how effective hypnosis is, and if it's not being used in pre-surgical care, and a method that increases anxiety is being used in pre-surgical care, then maybe we need to change that. So, hypnosis should be used in the medical field more often. It should be incorporated in reducing anxiety before surgery, and in other cases too. One last way that hypnosis can help is it can help by decreasing depressive symptoms in those diagnosed with depression. For example, as the Harvard Health Newsletter states, 84 depressives were randomly assigned to 16 weeks of treatment of either cognitive hypnotherapy, or CH, or cognitive behavioral therapy, or CBT. At the end of treatment, patients from both groups significantly improved compared to baseline scores. But the CH group produced significantly larger changes in Beck Depression Inventory, Beck Anxiety Inventory, and Beck Hopelessness Scale. Effect size calculations showed that the CH group produced 6%, 5%, and 8% greater reduction in depression, anxiety, and hopelessness, respectively, over and above the CBT group. Looking at how, compared to behavioral therapy, hypnotherapy is actually better by an average of around 6%, it shows how hypnotherapy should be used more often, especially in treating depression. Thus, if hypnotherapy is a cheap method that can effectively reduce depression, then maybe it can be used to treat those 75% that remain untreated in developing countries. Seeing as hypnosis can slow down, if not completely stop, the effects of mental illnesses and addiction. It shows just how much hypnosis would benefit the medical. Thus, hypnosis should increase in the medical field, and it should be more prevalent in today's world. In conclusion, I will leave you with a quote by Marcus Aurelius. "You have power over your mind, not outside events. Realize this, and you will find strength."